So today we're going to talk about several esteemed experts and I are going to try to talk a little bit about the three pillars of wellness as we see them. First, I want to just make some general comments. My name is Lyla Blake-Gumbs. I am an integrative medicine specialist. I'm trained in family medicine, and I reside my practice out in Lyndhurst, on the Lyndhurst campus. I also see patients here on main campus 1 day a week. So first, Cleveland Clinic and wellness. What is Cleveland Clinic's main goal? Well, they have really taken on a concerted effort at providing wellness resources for the community, for employees, and for our patients. And there are lots of resources that many people are probably not aware of. How many people know about clevelandclinicwellness.com website by show of hands? Okay. There are many items within that website that probably most people have not taken advantage of. I know I have not. There are daily mailings. You can get your daily dose. How many people get the daily dose? So this is an email that you can have sent to you on a daily basis. It includes information about wellness, things that are in the news regarding wellness, recipes, food items, just breaking news that's important for us as providers and consumers of healthcare to understand. There is an e-coaching information site on there where you can sign up to get health coaching electronically. We have a prescriptive wellness site where we review supplements so that people are armed, the consumers as well as us as physicians, because patients bring these questions to us about, well, I heard something about fish oil, I heard something about CoQ10, should I be taking that? And so you can learn a lot from these prescriptive wellness, and there is a huge, pretty much library that's been amassed over the last several years thanks to Dr. Sukul and her team. Stress Free Now. Is anybody participating in Stress Free Now beta testing? I am. It's unbelievable. I love it, and I cannot wait until everybody is able to participate in it. The Go to Sleep, the Go Foods for You, and there will be a brain health segment coming up on this site as well. So we're going to talk a little bit today. Each of the speakers will lend their expertise as it relates to these three pillars: eating patterns, activity patterns, and rest and relaxation patterns, and will impart their knowledge so that we can be the best that we can be at what we do, not only in the clinic, in the hospital, but also at home. Because as one of the speakers mentioned today, what we do at home, I won't say bleeds, spills over into what we do at work and vice versa. You cannot separate the two. And so one thing that I want everyone to keep in mind as well is we focus a lot at the Wellness Institute and the Center for Integrative Medicine on the mind-body connection. And I think it's important to keep in mind in each of these areas that we're going to talk about today that there is a mind-body connection that we really have to address. And a lot of the times we're so busy in our lives, we're not doing it. If we can incorporate what we just did just now for that 5 minutes, at least once a day, it really helps ground you. How many people could actually feel that light moving through their body? It's important for us to take time for ourselves because we need to be at our best. So I've got 49 seconds. I'm going to start introducing our esteemed panel of discussants. First, we have Michelle Drerup. She is a health psychologist and a behavioral sleep medicine specialist at Cleveland Clinic. I think I'll just introduce everyone once, and then people can come up one at a time and give their talks. Susan Joy is a sports medicine physician here at the Cleveland Clinic since 2000, I just learned. And Melissa Young is my colleague out at the Center for Integrative Medicine. She's an internist with additional training in integrative medicine and functional medicine. So without further ado, I'm going to invite Michelle up, and at the end, we will take questions as a panel up here. Thank you.
Good morning. Well, Lyla, you stole my line about, how lucky to start a speech before right after doing meditation. But actually in my role at the sleep center, I actually get to do relaxation with my patients sometimes multiple times during the day, depending on the patients I'm seeing, as well as in a group setting. So, you know, it's kind of part of my job to have these relaxation breaks during the day, so that makes it very nice. It's, you know, part of my role there. So, just a show of hands, how many of you feel that you get a good night's sleep every night or about every night? Okay, so maybe like 30, 40%. And you know, that's not, that's pretty consistent with what a recent poll has found. So there's a National Sleep Foundation puts out an annual sleep poll. And in 2007, the focus was sleep in women. And it was a telephone survey of about 1,000 women, ages 18 to 64, and they actually oversampled pregnant women as well as postmenopausal women. And what they found was about 67% of those that were polled say they frequently experience a sleep problem a few nights per week or less. So that means the other percentage experience it more. So why do you think women aren't getting enough sleep? So there are, you know, biological factors that play a role. There's definitely the hormonal issues and women's sleep changes within the cycle, menstrual cycle itself. And I'll have many patients with insomnia that they sleep okay, except premenstrually they really have difficulty, and then they kind of have this difficulty getting back on track because now they're anxious about getting to sleep again, right? So, but also in terms of thinking about those of you who have been pregnant, the impact of pregnancy, as well as having an infant or multiples at home that you're waking up through the night for. And so these factors in women's life play a major role as well. And then postpartum issues, or menopausal issues, and also, you know, the hot flashing and hormonal changes and the impact that those have on sleep. So also lifestyle factors play a really significant role for women as well. So in thinking about kind of the different roles that people have, I want you to think about this and think about which category of women, I'm gonna give you a list, and which category of women do you think have report the most sleep problems or report having most difficulty with their sleep. So we've got the working single mother. We've got empty nesters, so they've had children, but the children are out. We have stay-at-home moms, and we have part-time working moms, and we have which many of you may be, I like this term, this is the first I've ever heard of it, the briefcases with backpacks. So, right, so full-time working and having children. So a story I have to share is that, last night I was gonna practice kind of the timing of my talk. Well, it was picture day today at my daughter's school, and she's in kindergarten, so we all know how epic that moment is for your picture. So instead of practicing the timing in my talk, I got to choose outfits with her and practice posing. So, so if I run over there, it's my daughter's fault, I'll have to say. So out of that group, so we've got working single moms, empty nesters, stay-at-home moms, part-time working moms, and the briefcases with backpacks. Who do you think reports the worst sleep or getting? So the briefcases with that's what I would have thought too, right? Stay-at-home moms. Stay-at-home moms, yeah. So, you know, some reasons why potentially is, you know, thinking about their day, when the kids are napping, they can nap, right? So as we know with insomnia, napping disrupts your sleep drive, and so it can cause more difficulty sleeping at night. So it's not, they spend the most time in bed actually. They spend over 8 hours in bed typically, you know, per report, but they actually get less sleep. And that is one of the proponents that I espouse in my treatment, is that more time in bed does not equal better sleep. So now, briefcases with backpacks, there's still a really high rate of sleep problems. So it was just a little lower. So it wasn't outstanding, but the best, who do you think has the best sleep? Part-time working moms, actually. So I guess I would count myself as that since I work 4 days. So, but there's a really high percentage of, you know, disrupted sleep among women. One of the main factors as well is and they found this with the women who were stay-at-home moms, is co-sleeping with kids. that causes significant disruption, and as well as pets. So one of the patients, when I was first starting to work with, and she had insomnia difficulties, and she had a lot of difficulty staying asleep. And we tried some strategies, and nothing was helping. And then finally, it was after like 2 or 3 sessions, she said something about her cat. And I said, oh, you have a cat in the bedroom? She's like, yeah, I have 12. So that's one of the questions I make sure I ask in my initial eval. Do you have any pets that co-sleep with you? But in terms of why do we care about sleep, there are a lot of consequences of poor sleep. Even from your own experience, if you think about when you maybe had a night when you didn't sleep as well, you might have irritability, you might have a little less patience with your family. Sometimes people will report just not feeling as sharp or having some difficulty focusing, and that might be just after one night of sleep difficulty. But we know, there's a really strong impact of sleep on mood, right, leading to depression and anxiety, and then that further disrupts sleep. And so it's this very vicious cycle that people will get into. But also in terms of thinking about, there's a lot of increased risk for significant chronic diseases. So increased risk for diabetes, the things that it does to our hormones, our appetite and cessation hormones. There's also higher rates of hypertension correlated with sleep problems, as well as heart disease. And when I say sleep problems, I'm talking more, insomnia, obstructive sleep apnea, things like that. So now it causes bad things to happen, right? It's very prevalent. What can we do? What can we do, especially as professionals? We espouse these things to our patients, right? We encourage them to do all these things, and then it doesn't tend to be a priority for us. So that's the first thing, is really make healthy sleep patterns a priority, not a luxury, right? We think of it as like, oh, it's the weekend, I can finally get some sleep, but really trying to figure out what is reasonable in terms of trying to get that 7 to 8 hours of sleep a night. Now, there are short sleepers, and not everybody needs that amount of time. And I would guess probably the majority of you here think you're a short sleeper, right, because of the necessity of it. But really, if you don't wake at around the same time as your normal wake time, like on the weekend when you don't have to set the alarm, if you're sleeping several hours later, it's suggesting you're not getting enough sleep during the week. So even trying to figure out where can I get that extra hour, and if I leave the dishes until the morning, I know how painful that is, but they'll wait. And my husband really doesn't care, it's me, right? So, there's a new term that they've kind of coined, it's called social jet lag. So it's this idea, you stay up later on the weekend or when you're not working, you sleep in, and then when you have to work, right, Sunday night, oh gosh, I gotta get to bed early, you can't sleep, right? Same thing that happens when you're traveling, right? You're in a different time zone, you get on that sleep pattern when you come back. So the social jet lag is very common, and Sunday night is notoriously the night that most people have difficulty sleeping. So trying to get consistency. We've had these wonderful meditation practices during the day, and that's another thing, thinking about how to kind of unwind and relax. So there's something, trying to have a buffer zone before you go to bed to wind down. Well, what you do may be different. Some people find just kind of zoning out and watching their favorite show, your guilty pleasure TV show that you don't want to admit to anyone. And I won't say what mine is, a few of you know. But really having that time, especially if you're working late, right, and then you're having to go in early for those, wonderful 7 a.m. meetings, not just trying to jump in bed right away, but really giving yourself time to wind down. Especially at these conferences, I realize how much caffeine I drink when I'm here, and then I tend to have not sleep difficulties the night before my talk, but afterwards, because I've drank so much more caffeine than normal. So those things that you're, kind of are very aware of are also important to be mindful of. And if you're, you try some basic changes in your habits and you don't see improvement, seek some help. Try to find an option for you in terms of, what a provider that might be able to help you. That's the main thing I see is people with sleep issues. So, and there's also the online program as well. There's a table out there. So, thank you.
Thank you for the opportunity to present and welcome. How many people lose sleep because they're trying to get up early to exercise? And how many people lose sleep because they're stressed out because they need to get in better shape and they stress themselves out because they don't have time to exercise? I think what we have to keep in mind is our goals. Physical activity should be a part of our daily life. Get up, move, take phone calls when you're walking around, pace a little bit in the office. Physical activity is something we have to desperately build back into our lives because technology is taking it away from us. However, exercise also has separate goals, and that's something that's probably going to change throughout your lifespan. Each one of us at any given time in our life might need a little bit more boost of strength or fitness or endurance, or may have goals and bucket list items, whether it's a marathon, a half marathon, a bridge pose, a headstand, whatever it is that is your goal. Then there are times in your life that can be what motivates you to really influence your activity patterns. But I think at a baseline, the more we can get up and move when our lives force us to do this a lot more than perhaps we want to get up and move with your families and move with your loved ones and move with your office and just keep yourself moving. And I also, in the interest of time, will just make a quick plug for building in strength training somewhere in your life. And there are a lot of fun ways you can do that, because a lot of what we chalk up to aging is actually physiologically because we lose muscle mass as we age. And that's much more drastically seen in women than in men because testosterone is much more protective of muscle mass. So if you can 20 minutes twice a week find a time to just pump some iron, you'll find by 40 you feel better. By 50 you don't feel 50. By 60 you don't feel 60. By 70 you don't feel 70. So I think if we can maybe find better ways to creatively build some sort of resistance training in, a lot of what we sort of chalk up to well, I'm just this age, I'm that age, I'm going to be this age, you won't feel as old as perhaps your age tells you. So with that, I'm going to take my seat on the panel. Thank you.
Good morning. I thought I had 10 minutes to talk to you, and I only have 5, so I may speak a little quickly and leave a few things out. But I want to discuss the differences between real food and manufactured food and calories today, give you some key take-home points both for you and your families as well as your patients. And so I'm going to go over carbohydrates, fats, and proteins, what to avoid and how to make good choices. So in terms of carbohydrates, we've heard so much over the years. At some point, carbohydrates are good and bad, fats are good and bad, and it's now more about real food, choosing, and especially where carbohydrates are concerned, intact, whole carbohydrates, mainly in the form of beans, lentils, vegetables, fruits, and whole grains. I err on the side of whole gluten-free grains, but in general, whole grains are good choices. We really want to avoid the standard American diet, aptly named the SAD diet, that is very processed and takes out all of the good parts of the fiber and the carbohydrate, especially from our grains, and even erring more on the side of cooking up your whole grains in a pot, less of the even whole grains milled into flours and breads and crackers and cookies. It's interesting, when we eat 2 slices of whole grain bread, it raises our blood sugar the same as if we consume 2 teaspoons of sugar, and most people aren't aware of that. Avoid sugars. It's not just refined sugar. Sugar is sugar. So your agave, your brown rice syrups, your maple syrups are similarly processed. So we really want to minimize those as well. Try to choose organic produce to avoid your pesticides. The Dirty Dozen at the Environmental Working Group is a wonderful resource. So in talking about fats, I like to talk about industrialized fats, which are manufactured, versus the healthy fats. We're all aware now of trans fats. I'm not going to go into how they're manufactured, but they are initially produced to extend shelf life, for texture, to replace saturated fat like butter, and we found, of course, that they were much worse for us and increased our risk for cardiovascular disease more than saturated fat. So we want to look at the ratios of omega-6 to omega-3s in the diet. Omega-3s are those healthy fats. Omega-6s, even though there are some healthier omega-6s, in general more inflammatory. And it used to be just about a ratio of 4 to 1 in Paleolithic times, and now it's 20 to 30 to 1. So the goal, decrease the omega-3s in the diet, increase the omega-3s, focus on extra virgin olive oil, cold water fatty fish like salmon, sardines, anchovies, walnuts, flaxseed, avocado, which of course are monounsaturated fats. Proteins, we want to choose high quality protein. This is really key. In the anti-inflammatory diets and the Mediterranean diet really is focused heavily on plant proteins, which should be our focus. Legumes, nuts and seeds, certainly wild fish, not in the plant category, but that can be a healthy protein. Whole soy foods, and preferably whole organic soy foods to avoid the GMOs. And I don't think I really have time. Currently, I could take a question on it's really important how our animals are raised, what they're fed. And so if that's a question, I'll go over that more in depth. Talking about recombinant bovine growth hormone given to our cows, and then we consume that in our dairy. And it's interesting, a quick factoid, 80% of the antibiotics made in the United States goes toward livestock, not the medical profession. And when choosing animal protein, choose pastured or grass-fed, antibiotic and hormone-free. Thank you.
Can you all hear me?
No.
Okay.
Can you hear me?
Yeah.
Okay, good.
Okay, so I'm gonna ask a few questions of the panel, and then there should be some cards at the end of each row, and we'll try at the end, if we have some time remaining, we're gonna try to take a few key questions from the audience. So does everybody have those cards? If you could pass those along, that'd be great. Okay, so I'm gonna start out with a question for Susan. What is the difference between, how would you differentiate between physical activity and physical fitness? They're not the same. How would you differentiate those?
They're not. And physical activity really is a marker of how much you move your body during the course of the day. And physical fitness is a measure of your cardiopulmonary fitness, your muscle strength, and your endurance. And what's interesting is if you look at what benefits the public health overall, it's physical activity. If you look at what may benefit an individual as it relates to medical conditions or avoiding the effects of deterioration over time, then it's more physical fitness. So they have separate goals. There's some overlap for many people, but the physical activity piece, if we could bring the sedentary people to low activity, we'd get much more bang for our buck in the community than if we took the low to medium or the medium to high fitness individuals.
Great. And that kind of segues a little bit into goal setting for each individual person. What's the best way to go about, we've all done the New Year's resolutions, and for most people those don't work. What do you say to your patients the best way to set goals is and to stick to your goals?
I think it's to make small incremental change that's sustainable. I mean, I think much like we talk about the environment, and I think sustainability is a huge part of it. And I think when you go crazy for some fitness program that's 90 minutes a day, you're working full time, you're balancing your family life, you know that's not going to be sustainable. So if you can find a way to slowly build in incremental increases in your general physical activity, then you can start to carve out time for more planned, regular exercise, strength training, aerobic training, whatever else your goals are, depending on your personal medical history, your family medical history, and kind of what you want to get out of it. But I just tell people to start very slowly. I mean, for some people, it's walk 5 minutes an hour. And there's actually very interesting data out there that even if you have an 8 to 10 hour sedentary job and you go to the gym for an hour at night, you may not reverse the cellular death that occurs for the 8 to 10 hours you're sitting on your butt all day. So you may need those 10 or 15 minutes an hour. Get a walking desk, keep yourself active, and then if you walk for a living, whatever work you do, then don't go walk for exercise. Do something else that's novel and new for your body. Go take a yoga class, go do strength training, maybe take a spinning class, learn how to cycle, whatever it is that's going to be a little different than what you're already doing during the course of your day. So I think it's just a little personal inventory, and I also think it's a tremendously moving target for most people. Very few people are so beautifully regimented and set in their ways that they can do the same thing at 25 that they can do at 50 that they can do at 75. So it's a matter of kind of taking stock of where you are and your time and your resources.
Go ahead.
To connect it, and exercise can be very beneficial for sleep. The importance is not to do it too close to bedtime. So if you're exercising 90 minutes after work, I would be fearful, right? So another reason. But when I'm working with people on weight loss, and diet, I encourage them to not start on Monday, like, you know, because there's always like this, well, I'll start after this, or it's not a good time. And then when they are more busy and they're stressed, right, they don't know how to implement the things that, you know, they're like, oh, I'll start when I'm off this week. And no, start it when you're working, because that's your norm. So I think they have to, you know, try to, it's making it very realistic.
That's a good point. And one last question for you. What does the research show about the importance of resistance training as we move through the lifespan?
It's incredibly important, not only to maintain your lean mass, which maintains your resting metabolic rate, which helps you as you age. And if anybody wants resting metabolic rate testing, it's available where you can actually get your number and be compared to other people your age. But it's also very important for bone health. What's interesting is when muscles attach to bone, you know, the weight-bearing activities we do and walking and running and things like that are very beneficial to maintain bone health and bone density. However, when muscles pull against bone, they pull against the bone in a different plane than we normally have weight bearing. So you actually may see more robust changes in bone remodeling from strength training than you do even just from weight bearing exercise. So in addition to maintaining your lean mass, in addition, actually it gets some cardiac benefit from strength training, particularly if you do like a circuit training. But maintaining that muscle mass is really important as you age.
Awesome, thank you.
Not that any of us are aging.
Michelle, I had a question for you. You brought up this disconnect that often is present between, and we've all seen this, even if you're not in the medical profession, regardless of what your profession is, you may tell clients things that you don't necessarily follow, not because you don't believe in it, but just because life gets in the way. How do you, as a mother, as a physician, as a provider, how do you kind of work through that?
You know, I think for me, it's when I'm not genuine about something to someone. You know, I think it shows in my work. And so as I think being in my field, I'm talking about this all the time. So it always kind of gets me to be more aware of it and kind of allows me to check in as to, like, you know, kind of how am I doing with this, you know, this month, how am I doing in keeping these things up. So I think it's a very delicate balance. I haven't found it. Has anyone found it? How do you you know, kind of keep up those, you know, the things that you know long term are going to be the beneficial. But that's what happens for people is when they are overwhelmed or they get stressed, the things that are going to keep them healthier, the things that are going to help them deal with stress tend to be the first things that go, right? Oh, well, you know, the kids are back in school, I can't exercise anymore, and, you know, so I think you just have to kind of keep mindful of that, and, you know, having a friend that can kind of help as well, you know, kind of using the buddy system in terms of checking in. The support at work, I think, is essential in maintaining that balance.
I think that accountability partner piece that one of the speakers also brought up today is so important, because as we tend to do, we're not always taking care of ourselves, but we know someone's waiting for us at 6 in the morning to go for that run. You're going to get up and go for that run, as opposed to, oh, well, I'll do it tomorrow or I'll do it on Monday. Yes. So, Melissa, I'd like to talk a little bit about insulin and how insulin really, because it's an inflammatory hormone, how does that play a role in maybe some of the things that we're talking about here in chronic disease, weight, all of these issues?
I actually think it's a key issue, and more as our patients and even us are overweight, obese, we are inherently insulin resistant, and so we're overproducing insulin. We're a society where we're very focused on sugar as a fuel source and gives us energy when we're tired, and we're not always doing all the things that we need to be doing. And so we're seeing this as a really driver of low-grade chronic inflammation in so many people. And, you know, then we have the yo-yoing of our insulin, our glucose levels, and it's a roller coaster in terms of our energy, how well we focus, our cognition. And so, you know, things that we teach our patients in general is, you know, the basics of nutrition, keeping your blood sugar stable, removing the sugar, which is highly addictive as well, and we're finding this very clearly in studies and PET scans of the brain, the binding of the sugar to receptors in the brain, lighting up in the areas where cocaine, alcohol would light up as well. So, teaching people about, big food and how the food manufacturers are really impacting our food choices by making our food addictive with salt, fat, and sugar, getting them off that roller coaster, regular small meals with protein, healthy fat, and really helping to reverse the insulin resistance, helping to reverse the chronic inflammation, which is such a driver now, as we know, of all chronic disease.
So I've heard it said that our current children, the generation that are our children now, by the time they're adults, they will have a shorter life expectancy than we have at our age right now. And the majority of that is going to be due to diabetes and morbidities related to that. It's been said that if a foreign country were doing the things that our food industry, and I'm not trying to slam the food industry, but what we're doing in our country to the children of this generation, a foreign country were doing that, we would probably go to war with them. But yet we're seeing the children now suffer the consequences of the sugar, basically assault that's happening. And so I know this isn't supposed to be commercial, and I don't think this is a commercial statement, but there will be some free screenings of the movie Fed Up that will be happening throughout the Cleveland Clinic campus over the next 2 months, 2 or 3 months. So look for those flyers. I know one of them is going to be next week, I think next Tuesday. So keep your eyes open for that. Sure. We're going to take some questions from the audience. Okay. Thanks. Okay, so I'll direct this to you.
Okay.
Is stevia okay? And well, we'll do that one first. Is stevia an okay sugar substitute?
I think there's pros and cons to stevia. In my opinion, it's a plant-based sweetener, so really studies have shown it to be quite safe. It's very sweet, so you only need to use a little bit. But the drawbacks are, and especially in people who have prediabetes, diabetes, who crave sugar, is it's going to continue to drive those cravings. We really want to shift our cravings for salt, fat, and sugar, and we have to do that by minimizing those in our diet, eating regularly, and again, keeping our blood sugar pretty stable. So I think for someone who wants a intermittent sweet taste on their cereal or their tea or coffee, it can be a very good choice, but it's not something we want that sweet taste in our diet on a daily basis.
And also the point is that our taste buds will acclimate. Anybody who's tried to reduce their sugar intake, say in their coffee, if you've been at 3 and you go down to 2 for a little while, you can notice a difference. But then if you ever go back to 3, it's very noticeably sweet. Another question, let's see who this would be for. Oh, no, I haven't seen one yet. Okay, what's so bad about GMO?
I think there's mixed literature on GMOs, but we are seeing a lot more allergies related to GMO crops and foods in people. And, it's very different here in the United States than it is in Europe, where in Europe, they actually will not endorse a particular food unless there are very clear studies that it is a safe food. And here we do the opposite. And so I think until we know a lot more, ideally, it's best to avoid GMOs and continue to look at the literature as more and more studies are done.
Okay, thank you. Dr. Joy, I have a question for you. Is weight training and resistance with weight different or necessary if you are doing yoga frequently with plank poses, etc.?
That's a great question. There's a lot of overlap. I mean, certainly depending on your yoga practice, there's a lot of intrinsic strengthening with yoga, and a thing like a plank is a great test of your core stability and strength.
But there also may be some benefit to adding a few other exercises to what you do. So let's say, example, you're doing yoga because you used to run and you have some arthritis in your knees. Well, there may be some other targeted strengthening exercises for your hips and legs that may help protect your knees so you can continue your yoga practice later. So there's definitely some overlap, and there may be ways to substitute what you do in yoga differently with different types of strength training.
Okay. Question for you, Michelle. What schedule would be healthiest for a person who does shift work to maintain? For instance, a week of nights, 1 of days versus a month of nights and 1 month of days, etc.
Find a new job. No. So say those options again. Consistency typically tends to be best. So really when people are coming to seek help for shifting shift work, right, where it's rotating, and they, I mean, I've heard the most horrendous stories of, I'm 1 week on nights, then I go to, like, going backwards is even harder. So then I go to days, then I go to mornings. So the rotating shift is impossible.
So, but it sounds like if you have to do that, because some
people do, right?
Certain jobs you have to. Would a month of each be preferable?
Yes. The more time, so you can get into some type of rhythm, or and then the other issue is when people are on night shift, they really don't oftentimes want to sleep at night when they're home, right? Because when you have the longer extended periods in between shifts, so they might be so many days on, but then they get a week off. Okay. That tends to be better, so that they can kind of regulate back to their family schedule and have time. So.
And I'm going to let you guys fight over this question. What would you choose between getting adequate sleep or adequate exercise?
GMOs. I don't know, but she makes me tired and she makes me hungry. I don't know. Whoever wants to have a go at that. No, there's no boxing gloves in here, so you got to be gentle.
Yeah, I think it's really. I don't think there's a choice. I think you have to try to find the balance of it. So I'll take half and half if that's possible.
Okay. I also think it depends what you do during the day. So if you literally are running around like a mad person all day long, literally, your activity monitor is exploding, then you probably need to sleep. If you sit at a computer all day, you probably need to exercise, and maybe you'll be a little bit tired, but you'll make that time up and you'll adjust your schedule. So I think it depends a little on what you do all day, too.
Okay. Yeah, I agree. Individualizing it and then trying to find some balance between the two.
Melissa, what about GMOs? They've helped us to survive, grow, and provide foods to parts of our world where not available, but we hear so much negative press about them. What is your take on GMOs and their role in our food supply?
As I said earlier, I mean, I think it would be...
It's all right, they can fall.
Okay.
We're done with those.
From my perspective, I want to see much better data on their safety, and there's been data and clinical case studies on some of the drawbacks of GMOs. So from my personal perspective, I avoid them. I teach my patients to avoid them until we know more information. And it is very challenging because it has helped with world hunger and feeding people. But we need to continue to do research in this area. But I'm always cautious until I have better information.
And along those lines, how far can we trust the organic label?
Well, I think we actually, in general, can trust an organic label. There's, I think, overall very strict regulations on that USDA organic label. But, we have to also understand that some of those GMOs will slip in due to drift. And, because something's organic, there aren't synthetic or pesticides used, but there are approved natural pesticides. I think there's still ongoing studies that need to be done about the safety of those, and they may need to actually use more of the natural pesticides than the synthetic ones. So, this is really ongoing, and we need to keep our eye on the literature. But in general, I do think that choosing organic, it's well regulated to the best of their ability to do so, and a better choice to minimize our exposures to the GMOs and to the pesticides and herbicides.
And along those lines, there's a great website that talks a lot about organic foods and what it really means, as well as GMOs, and that's www.ewg.org. It's the
Absolutely.
Environmental Working Group.
Fantastic. And they also talk about safety of cosmetics, cleaning products, as well as foods.
Okay. Sunscreen.
Sunscreen, yes, very much so.
Okay, question now moving a little bit more into the hormonal arena. Do you have any suggestions, Dr. Young, for postmenopausal women and sleep disturbance? So you can both weigh in on this, please. This person mentions they're still getting kind of hot in the evening, at night, and now very light sleeper. What would you do in this scenario?
Do you want to
Go ahead.
Okay. So certainly I think it can be beneficial to assess the impact of the change in hormones in the perimenopausal time and that impact on sleep. We tend to produce less progesterone around this time, and that helps us sleep. It's a very calming hormone. So I like to also look at the continuum of adrenal function, a little bit different from my purely conventional training, but I can sometimes avoid using hormone replacement by helping people with their stress levels. A lot of hot flashes, night sweats are driven by adrenaline with lower estrogen levels. So it's really about looking at the whole person, their lifestyle, how are they eating, how are they managing stress, hormone levels, nutrient levels. So that can make a big difference in helping women in the peri and postmenopausal time sleep better.
You know, and in terms of with the sleep kind of perspective, that at that time there's a, you know, that's when women catch up to men in terms of their prevalence of obstructive sleep apnea. So that's always something that I'm thinking of if someone is having difficulties. But, and, you know, all the behavioral kind of strategies are where I'm typically helping women work in my work. And then when, you know, maybe if, especially a lot of times that's what they want. They kind of want to avoid medications. But if they're not seeing improvement, really kind of talking to them, you know, go see the provider, really have a talk about what your concerns are, you know, are they, you know, just because of the media, or are they, you know, valid concerns if, you know, some of the other strategies aren't helping their sleep.
And Susan, I'd like to ask you about a question that one of the audience members posed related to any suggestions that you have for really incorporating physical fitness into an already overwhelming schedule where you really feel like there's no time. You have to, you know, you're not getting to bed until late. You're getting up very early. And for people that have young children at home, perhaps, or parents that they're caring for, and a full work day, how do you fit that in?
God, I wish I knew. I think this is where it's a bigger societal reorganization of our priorities in terms of, you know, there are so many employers that believe your productivity increases just by the sheer number of hours you spend doing something, not the quality with which you do something at a more efficient speed, where maybe you have one 15-minute block in the middle of your day where no one's texting you or calling you or paging you or whatever other vile device is finding you. But I think we need to really analyze that. And I think that there are people who are in situations where they feel that is their only option, and they're guilted into thinking that if you miss this meeting because you've been stressed out by your family and you decided to go to a spinning class at 6 in the morning and you miss one meeting but you make up the work, I don't know. I mean, I think if we could culturally find a way that that's a more viable option for people. I mean, working ourselves to death doesn't seem to be the answer. So in the short term, I think it's just a matter of carving out time wherever you can. I mean, studies suggest you can even accumulate 5-minute bouts of physical activity over the course of a day. And if you accumulate 30 minutes, it may have the same effect at the cellular level as doing 30 minutes at once. So I'm sure we could all find 5 minutes a day where we stop griping about how hard our life is and just go do something fun for 5 minutes. So I think just small, tiny, incremental change. And then I think, you know, we owe it to ourselves as healthcare providers and people in this greater scheme to figure out what's really healthy for our community. And I don't think it's the direction that we're going, but.
Thank you.